practice that they have, Your Body by Design Medi Spa. We do have a very interactive support group meeting. We have some select few patients, me included. So before we get started, I just kind of want to introduce or have everybody kind of briefly introduce themselves so we kind of know who's who. So I've already introduced myself. I'll let Dr. Mussenden introduce himself, and then you guys can just say your name, if you're a current patient or not, and so forth.
Okay. I'm Carol Mussenden. I'm actually a gynecologist. I actually was practiced here for years. And I have a history of having done liposuction for 10 years, therefore got interested in what's going on with getting fluid out of the body and helping with pain management. And so we do a lot of this in our practice. And I'm here to just give you all some information. I think you're going to get some information that's going to be helpful for you. And for those of you who suffer with the problem of lymphedema, no matter what it's caused by, there are some things that you can do to help improve it. And I'm talking about diet. So we'll talk about that today. My daughter is Camille Jackson, and we've been practicing as partners for
long time.
Over 10, 15 years, something like that. We've lost count. And it's really a blessing because now she lives in Atlanta. She's married now. She got married in October. And so she goes back and forth. And so she's here for a couple weeks and she goes back down with her honey. And so Camille does many of the procedures in the office. And of course I do too, because it started with me. The one thing about doing what we do today, and when we talk to you about this, is that practitioners, specifically physicians, have to be open to learning about things that they don't know. Okay? You've got to be open. Because if you're not open, you won't even entertain that there's something that you didn't know that you didn't know. Okay? So that's where I was, praise the Lord, many years ago. And so that's why I incorporate this as complementary care in the office for specific patients. And we use lymphatic drainage not only for lymphedema, but we use it also for pain management, which you'll see today with Barbara. And we also use it for body reshaping, non-surgical body shaping that works. It's incredible. I didn't even believe when I designed it that it was going to work, but it worked. And also for facial rejuvenation. So this is what we are going to be using today. This device is a device that was actually designed by a naturopathic doctor. Now, naturopathic doctors are doctors that treat without medication. And when I first went to look at this device, again, I was going because it was something maybe I needed to see, but I didn't know what I didn't know. But when I saw the results, how can you argue with results? So we're really excited to be here today. So Camille?
Yeah, well, thanks. Like she said, she is the one who brought this into our practice. She taught me. And I tell people that I got the benefit of having free med school. So you have to take advantage of your network, and if you're blessed to have information that is given to you, it has helped me a lot in this holistic side. So like she says, I do a lot of the lymphatic drainage in the office. So almost everything y'all have, I see all the time. And the results, like she just said, you cannot deny the results. And when I say that this spans this lymphatic system, this lymphatic channel was what we were given to heal the body. We have to stimulate that and stop the stagnation for the body to be able to heal itself. Yeah. So that's essentially what this machine does. It stimulates the lymphs to open, pull the fluid that is stagnated in that system, and let the body reset itself so the body heals. Okay?
Okay, great. So you all want to go ahead and introduce yourselves because I'm going to start talking. I do talk. So you all better go ahead and introduce yourselves.
My name is Ruth Perkins. I'm one of the stars today. But I also want to say when Camille called the doctor Mom, I thought that's what I heard. I don't believe it.
Yes. Yes,
that's right.
All right.
Thank you.
I'm Marcia Holton, and I am a current lymphedema patient.
I'm Greta Davis, and my husband is a lymphedema patient.
And I know Miss Greta, too. Long time.
He didn't come today. Or did he?
No, he was here yesterday.
He was here. Oh, he didn't want to come back. Well, welcome.
Well, I can start. I'm Janice Taylor. I'm one of the lymphedema therapists here. It's a pleasure to see everyone here. We have this quarterly meeting, and I'm so glad that Dr. Mussenden has graciously provided her time to show us some really interesting information.
My name is Melissa, lymphedema therapist, and yeah, I'm super excited. Right here at the table. Yeah.
Okay, I'll stand up. My name is Dion Beal. I'm the nurse navigator here at Doctors Community Hospital, and I'm just here to give more information about your program.
Awesome.
Great.
Thank you for coming.
Hi, my name is Tulu. I'm the nurse navigator for the breast center.
Great.
So a lot of my patients do come. And I'm happy to meet everybody.
Great.
I'm actually really
Great.
excited you guys came. Thank you.
Great.
You want to introduce yourself?
Sure. My name is Dwayne Holton. I am the husband of Marcia Holton, and I'm also the support, the nuisance, the accountability.
How about that?
Thank you.
Hi, my name is Deborah Harris. I am, 13, 14-year-old lymphedema patient. When I first came here, I could barely wear shoes. I couldn't wear boots. I'm now wearing boots, wearing
Praise
shoes,
the Lord.
and on the mend.
Praise the Lord.
That's right.
And is that your daughter?
Oh, this is my granddaughter.
Granddaughter. Oh my goodness. Hi, granddaughter. You cutie patootie.
Hey, go ahead, Miss Mary.
I'm Mary. I'm the front desk person at the
I got a face now.
And I'm Shirley Williams. I'm the office manager for rehabilitation here at Doctors Hospital, Capital Orthopedics as well.
Oh, great.
Hi guys, my name is Kenny. I'm one of the redox techs at the Lymphedema Center.
Great.
Hey guys, my name is Mitch. I work with Tactile Medical, so we provide at-home solutions for compression devices, and this is my first time at the meeting.
Great.
So I'm really excited to see what's going on and how we can support you all.
That's great.
Great.
Mitch for supplying the food. or-
Thank you.
Yes, thank you.
Eat up, please. Eat up.
And I'm Diane. I'm one
Awesome. Well, thank you so much for the introduction, guys. If you haven't gotten food, please feel free to go get some, and then I'll let Dr. Mussenden take the floor.
Okay.
Enjoy, guys.
Okay.
How this is going to roll today is that, so I'm going to be talking to you about some things that are very important in knowing about lymphedema. And what I will do, and what I'm doing is I'm just providing a little cover for our client here. Little short thing. Camille, see.
Do I take a flying leap or what?
There you go. Okay. All right. So. All right. There you go. Look at this. Okay. All right. So. Very good. So everybody has an article in your folders that talk about inflammation. This, okay? You don't have to read it now, but I only gave you the first page of 3 pages because this is the important thing to know. So, as I have evolved, I trained in the OBGYN and graduated. Believe it or not, I've been practicing about 40 years. And so when I was in medical school, we were not trained on the significance of inflammation. And we were told that when you see anything inflamed or red, that there's an infection. But we did not realize that the inflammatory process had already started before we saw the signs of it. Because back in the day, they didn't really realize, they didn't really get that. Over the years, as I've evolved and I've seen things happen that I know only God can do, I knew that there were things that I didn't know that I didn't know. Some of my best friends were naturopathic doctors, herbalists like Akmal Muakil, who lives near here and still is trained a healer. And somebody you may know, a young son, we ran the circuit and did some things, talking in various places about health and healing and all kinds of things. And so they would tell me, you know, Doc, that inflammation thing is the thing that causes everything. It causes disease, it causes cancer and illness. And I would look at them and say, you know, because I never saw that in the medical literature. But the truth is, if you look now, in the medical literature, we talk about how inflammation is the cause of disease. And the problem is our bodies are inflamed, okay? Every one of us in here has an inflamed body. And depending on how you take care of your body is, some of us are more inflamed than others. Barbara's walking around right now limping. That's because she's inflamed in that body, okay? And it needs to be uninflamed. Now, there are things that we can do to help inflammation. The most important part of the body to help with inflammation, anybody know?
The gut.
Well, that's important, it's important. But what helps to get rid of the inflammation? What are we here?
Water.
What are we talking about today?
The lymphatic system.
Lymphatics. It's the lymphatic system. The lymphatics, this is what God gave us. Lymphatics run right along where blood vessels are. Okay? So wherever you see a blood vessel in your hand, there's a lymphatic kind of entwined around it. You don't see it. Okay? The purpose of the lymphatics is that the lymphatics are supposed to draw out fluid and toxins from the vessels, because the toxins are inside our bloodstream. Okay? So the lymphatics should roll just like blood. So it should move fast. Okay? And so what happens is that instead of being able to do that, we're so toxic that the lymphatics are already overrun with toxins in our body from what we eat, from what we breathe. What's the most inflammatory thing you can put in your mouth? See somebody. It's bad for us.
Cigarettes.
No, that is bad, but no.
What's sugar?
You got it, girlfriend. It is sugar. It is sugar. It's the worst thing you put in your body. Okay? So, your sugar, and I tend to be a sugar addict at times. I like sweet stuff. Okay? And it is the worst. Okay? So we are inflamed, and so the sugar alone sets up an inflammatory process in the body. Okay? And that's why I said some are more inflamed than others. Okay? So, what we want to do, the lymphatics, unfortunately, are so clogged that they're not rolling like the blood, straight through the body, go to the heart, and go into the trash can and be eliminated. No, they're stagnant. So the lymphatics are stagnant, and instead of being able to remove the toxins and the fluid that we have in our body, it looks like the LA freeway at rush hour. Okay? So what we do is we are going to uninflame the body by opening up the lymphatics first. And it's really not a hard process. You all are used to having it done manually. We do it using a cold laser, okay? And it is something that Camille's going to start doing now. Now, Camille, tell me, you can do which leg? Yeah.
This one.
So, what we're getting ready to do is to treat lymphedema in the lower leg, just one leg of this patient, okay? And so she has swelling, not as marked as some people, but it's significant. You can see that her little foot is like she got little pig toes, and she's got swelling. It's indeed on the top of the foot.
So one of the things I want to say before we start her is that we did something before we touched her, so that I could show you all what this does. What do they say for you to not eat when you're on a medication?
Grapefruit.
That's right. You know why they say no grapefruit?
It interferes with medication, doesn't it?
But do you know why? What the interference is? Grapefruit is extremely anti-inflammatory. So if they have you on a med for inflammation, and you eat grapefruit, which uninflames, guess what they don't have an excuse to do? Keep you on the meds. So, I rubbed some grapefruit oil on her foot. How long did it take you to feel a difference?
Well, like a minute.
A minute. All I did was rub grapefruit oil essential grapefruit oil on her swelling, and the body begins to uninflame, right? So now we'll go to the cold laser part.
So let me clarify one thing. So when we are talking about uninflame, it's not a bad thing to uninflame. But if you have somebody that's on a prescription medication that thins the blood, it's a possibility that if you use something that's anti-inflammatory, it can thin it too much. That's what she meant by that. And so the thing is there are some people who can't. Now, when you're using it topically, it's not quite the same issue. But they'll tell you not to eat grapefruit, because you're ingesting it. But this is being locally absorbed. Okay?
All right, want to talk about the trash can?
Okay, the trash can of the body is called the thoracic duct. And the thoracic duct is a duct that is actually located up here under the clavicle, near the clavicle, up in this area here, that literally it's the biggest trash can of the body where all the lymph fluid comes. So all the lymph comes from the lower extremities, from the upper arms, and it goes into the thoracic duct, then dumps into where? The dirty part of the blood.
And when you, across the clavicle, the thoracic and across the clavicle, sometimes if you can, these are trigger points here, and reflexology points will also tell you about points along the clavicle. Sometimes if you take your hands and rub across your clavicle and you feel little jelly pockets, those represent places in your body you actually have pain or inflammation, toxic fluid. And if you rub them out, oftentimes, you can relieve yourself of that pain, right? So point 1 is the thoracic duct and the clavicle. Point 2.
Under the arms, the axillary nodes. When we have breast cancer, what is it that they do in surgery in some cases? Remove lymph nodes, because that's what will be draining from the breast. Okay? So that's strategic. So when they put the dye in, they know which nodes are near the breast mass. Okay? So we open up the axillary lymph nodes. One's under the arms. Okay? All right? Then there's one other. Let's do the upper abdomen.
Okay.
Maybe you can just pull your dress up just a little. So we're going to open up the umbilicus. That's the lymph nodes in the navel, where the placenta, where we are attached to our mother in utero. Okay? And so there are lymph nodes, a wealth of lymph nodes, blood vessels and lymph nodes around the umbilicus. So we're using the cold laser. You see this little orange lighting. Does it hurt at all? Great. So open that up.
So how deep does that go in far as millimeters, do you know?
It stimulates when we use oils, various oils, we use oftentimes oils to help get it to stimulate deeper. It'll go probably, it goes into the subcutaneous tissue and below. Okay. All right.
Then, next point.
The lymph nodes in the groin. Okay, groin lymph nodes. Okay. So we're doing the lymph nodes there to open them up, stimulate them.
What's the one under the arms over there?
Axilla. Okay? Under the arms. Axillary. Okay? So these are all the ones that we work on. Now when I'm doing post-operative management of patients who've had liposuction and tummy tucks and that kind of thing, I'm generally only opening up the lymphatics up top. I don't go down into the legs at all, because if they have had just things up in the upper abdomen. Okay? All right.
Okay. So then we go to the foot. So where the actual lymphedema is. Many times if we open up a client right where she is and leave her on the table, the body will continue to...
Sorry, I have to get my IT person. It's not... it had my face.
Stop touching it.
Okay.
There.
It's got me. It's my face.
Hilarious. There.
Okay.
All right. So many times the swelling will start before I even touch the foot. Because she's open, if I let her lay here, and I let her lay here like an hour, her body would pull this and her swelling would go, all right? But what we do is we go straight to that area. And what we normally use for a solution, I am a fanatic of mango butter. Butters, shea butter, cocoa butter, mango butter. Mango butter actually stimulates cellular turnover, which is why I like that better than shea. But then I will mix that mango butter with anti-inflammatory oils like grapefruit, frankincense, peppermint if there's pain associated with it. And we put this right on the body. I will also add a little Himalayan salt sometimes. And we simply do the same thing we were doing to open her on her foot.
What about lemongrass?
Lemongrass is good too. Lemon, rosemary, peppermint, those are all energizing oils. Those are metabolizing oils. So you should really get to know some of the important oils, especially for swelling, like peppermint, frankincense, lemon, lemongrass, rosemary. Those are all, eucalyptus is another one. And what we do literally is use the cold laser on her foot.
And how long is normally a treatment with this?
Normally about 45 minutes.
Okay.
It really doesn't take that long. The way we were trained, it really only takes about 20 minutes.
That's right.
It only takes about 20 minutes.
And plus, we're only doing her lower leg here today.
Right.
So it's really not that long. One thing that's interesting that I thought I'd tell you so you can know. Now, you remember that one of the gifts that was given to baby Jesus was frankincense.
Yep.
That's because frankincense is not only an anti-inflammatory agent, it's like an antibiotic.
Yes.
So when they didn't have antibiotics then. But for wounds, it was very good because they would use frankincense on wounds that people would have to try to heal them.
Wow. And normally if somebody, even though we're doing one leg in her, if she was coming for an appointment at the office, I'd do both legs. I'd do both legs, probably her entire leg, actually. And this doesn't take long.
From when you started.
You can see, right?
I can
Yeah,
see
you can see. It's going away. You can't find results.
Mm-hmm.
So it's got to mean something. We took her measurements before we started. So when we're done, we'll take her measurements again, and you all can actually see.
Now, one of the other things that you also have in your folders while Camille's doing this, everybody has something about watch what you drink. I want you all to really look at that because the bottom picture is plain water. And I want you to look at the sugar content of the substances that are above. And what did we say is the worst thing in our body? Sugar. And every one of them, it tells you not only how much sugar, but how long you have to walk to burn off that sugar that you just put in your body. Okay, so just something simple like that, you know? So if you're constantly consuming sodas or things that have sugar in them, guess what? You're constantly inflaming your body. And in particular, for those of you who have conditions such as lymphedema, that's the last thing you want. You shouldn't let a sugar drop go by through your mouth.
Does anybody know how to make your own alkaline water? Nope. That's good to help detox, but I'm speaking alkaline water. You know how to alkalinize your water?
Is it that do you boil the water, or do you drink distilled water?
Nope.
No.
Anybody know?
Lemon.
That's a detox. That helps.
Okay.
Lime and Himalayan salt.
Oh.
Lime and Himalayan salt will alkaline your water.
But what about, what type of water would you use? Would you use distilled water, or would you use
Yes,
water?
yes.
But some people I don't like distilled water.
Not only that, but I tested the waters, and distilled water has a lower.
Yes.
It's more acidic.
You want to have things that you want water that has electrolytes in it. I happen to like the taste of smart water. It's just, I happen to like the taste of smart water. But a lot of those waters, remember what we're also doing, even those waters that they claim are alkaline, they put them in plastic. So, and in that instance, you're putting them in plastic bottles. So you're affecting that anyway. So you have to be really careful and knowledgeable about what makes things alkaline, how you can keep your body alkaline in spite of what we eat.
So the reason that for those of you who may not be familiar with the issue about alkaline and acidic water, acid is bad. So when your body is more acidic, you're more likely a setup for inflammation. So that's why, and you can actually Google alkaline foods and acid foods and see what you need to take out of your diet. I mean, this is all on, you just Google it. You find anything you want on Google.
Okay. Next part.
That's a good question.
It's the Himalayan salt that balances that bit of acid out of that lime.
Yeah.
Okay. Next.
Okay. Wow, look at the foot. Okay. You want me to go ahead and measure?
You want me to do the microcurrent first?
Oh, yes.
Okay.
Wow.
And Dr. Mussenden, what's the name of your machine again?
This is a Jade machine. And Jade machine. And what it is this. It's two components. It actually is a machine that has, we can use a cold laser on it to open up the lymphatics. And it also has, the Jade refers to color. And color is are the things that are based on what you're treating for. So for instance, it's a color wheel here. When I was using this for my patients who had swelling from surgery, and we would use it also if we were treating lymphedema, we'd use orange, because orange pulls water out of the tissues.
So from the holistic perspective, when we're talking about the body, what are we talking about? We're talking about energy. We're talking about frequency, vibrational frequency, which means vibrational frequency is affected by other vibrations, sound, color, other energy-based frequencies, and this machine has a number of them: color, sound, light, all in the same machine.
And for those of you who understand that, and you can always learn about that, you can go online and you can see what things need to stimulate. Now, when we have Barbara come up, she has pain. So the colors for pain are either violet or blue. When you go into a spa, they always tend to have lavender smells because it relaxes, relaxes the senses,
So the second thing we're doing, microcurrent, radio frequency. We're using frequency to stimulate cellular frequency. What heals after the lymphs detox? Cells, right? So the cells need to be jump-started sometimes, turned over, so that they can effectively treat the problem. She doesn't feel anything. Do you feel anything? You don't feel anything except for some metal.
Sometimes if we forget to move one of the probes, and it'll sit there instead of the current being able to go between the probes, it kind of just sits there, and if the person says, "Oh, I feel that," and it's like. I don't know if you all have heard about the salt cave in Bethesda, Maryland.
Very important for
The
y'all.
Himalayan salt cave, Bethesda. Yeah,
Very
it's
important
really
for
nice.
y'all.
You all should do a trek there. Take the patients there. Just rent the place. And you sit in this huge salt cave. It's very relaxing, soothing. And what happens is, and you say, well, how can you sit in the salt cave and something happens? Because what they do, they stimulate the breakdown of some of the things. They use something to...
Himalayan salt.
No. They use something that gets some of the salt into the air.
Oh, a
So you're-
diffuser.
Yeah.
Yeah.
And so you're actually breathing it in. Very nice. For those of you particularly who are bothered with this kind of problem. And you can also get there the kinds of things like to enhance your treatments, some of the, like a salt cube, and you can just, wherever you have the lymphedema, you just rub it on the area maybe once a day after your shower.
Their Himalayan salt is the best. They have white Himalayan salt, which I prefer. The Bethesda Salt Cave has white Himalayan salt. They have pink too, and pink has more minerals, but white has more magnesium in it. So I prefer the white, but both are really, really effective. I send everybody there to go get their salt. But Himalayan salt is Himalayan salt. You can get it at Costco, you can get it at TJ Maxx, you can get it at the grocery store.
Home goods.
Home goods.
So and you just use it like regular salt?
So I cook with it, I drink it, I take it by itself and place it on areas of pain, right? Pain is fluid. Himalayan salt draws out that fluid, helps with pain, swelling, breathing. You got asthma, COPD, take some Himalayan salt, place it on your chest right here for about 5 minutes, and then wipe it off. You don't need to put it in or mix it with anything. Your blood flow is going to activate that. So yeah, use it for lots of things.
Yeah. And so like when I treat people who are post-operative cosmetic surgery, they always have swelling in the tissues. And so when I finish, I actually place Himalayan salt on their body, on their whole body, and it'll drain out some of the salt that I've kind of stimulated to get more to the surface.
So we take another, what's this scar from on the top of your foot?
Because they didn't know I had lymphedema and they did a venogram.
So I asked what she has this little scar from on the top of her foot. And I asked that specifically because above the scar, she's got thicker scar tissue, which is adding to the lymphatic problem. So as we focus on this little scar, we can use the microcurrent to break that scar tissue, which is eventually going to also help her scar go away, right? Because the scars are essentially pulled in the skin because there's scar tissue underneath. When we use this to break that and to have the body take this out, the skin is cellular. That elasticity will heal on top of itself. So you notice here where her thickness is up top. Right above the scar, right below the scar. So when people have thicker areas of scar tissue swelling, I add a second laser to this because we could do a little percussion now and be finished with her treatment. But to show you something else that we use what's called an Erconia cold laser. Dr. M can tell you about this cold laser. She used to use this when she was doing lipo.
So when I first went to train in Costa Rica at the American Cosmetic Center down there, they had a company who came in and was talking to us about the Erconia. And we actually, oops, I did it again.
Yeah, stop touching this. Thank you.
Okay, so they actually came down and talked to us about the Erconia laser. And the way that I knew that it worked, so this is what we did. We were doing liposuction on a person's abdomen. So we treated one half of the abdomen with the Erconia, doing exactly what Camille is doing. And the other side we didn't treat, okay? Now, when we began to aspirate or suction out the fat in the side that had been treated with the Erconia, the fat looked like a banana milkshake, yellow and smooth. On the other side, it looked like yellow cottage cheese. It was amazing, the difference. And just doing this. And so what it's doing is, in the lay terms, basically, it goes in, causes the fat cells to swell, break open, and liquefy. And when that happens, it doesn't come out chunky anymore. It comes out liquefied. Amazing, most amazing thing. I was so glad I saw that.
Do you feel looser in your ankle?
Yes, I do.
Yeah, you can see how her little foot isn't as fat on top. For those of you who are close. But you probably can see it from the back, too, because you're seeing her from the side.
Can I ask a question?
Please.
The mole on her foot, would that be a concern?
That was actually us. We took her measurements before we started.
And to take measurements, you got to know where you put the mark. You measure, right?
Good question, though.
I'm like,
me
had that
either.
check. No, I can clearly see the change.
And listen, and for you all who are practitioners, we weren't struggling like you all.
Right.
We were not
Don't talk
using.
about it. I'm trying to think how
Saving your body. Cold laser.
Let's see what DCH can do to that.
Right.
Did our boss come in yet?
Okay, you need to repeat that.
And when we're done, your scar here will actually be slightly less pronounced.
And how long does that last?
What? This?
The procedure, yeah, the tissue texture
Oh, before it
changes
goes
afterwards.
back.
Yeah, before it goes back.
I haven't seen it go back. Because remember, once this comes out, it's coming out in the urine, but we're resetting the body and speeding up the body's function. So we want them to come, of course, for a series. But if they are then taking this and continuing to do at home what they can to alleviate this, most of the time, once I can feel the scar tissue, the hard tissue gone, they're fine.
And the thing is, nothing's going to work by itself. So, you got to do work.
Yeah.
Just taking on some of the things we talked about today, drinking more water instead of sodas, trying to keep inflammatory products out of your mouth, and that's a tough thing to do. It's really a tough thing. Doing more things like Atkins eating, more protein, low carbs. For those of you who are sugar addicts, you go and try how many of you like chocolate turtles? Has anybody ever tasted Atkins chocolate turtles? They are divine. Yes. Yes. And let me tell you, they are delicious. They have the nuts. You can chew on them. It has the caramel. It's like regular turtles. And they have the other one. They have chocolate ones with caramel in them. It's amazing. So you start doing those kinds of things. You start moving into something, that's going to be better. The water, drinking more water. If you drink a soda every day, maybe what you can do is to start drinking a soda every other day. But see, one thing that we know, for those of us who really need to make a difference is that if you cold turkey with food, it's much harder. But if you just start weaning off, just weaning from what you've been doing, you see?
Anybody know what this is?
It looks like a massage.
But what's another name for it?
What'd she say?
A vibrator. Yes. But I was thinking more, what do drummers do when they beat?
There you go.
And so what are we talking about? Frequency, vibration, percussion, right? So we want these cells to do a little movement. We percuss them, right? Many times if people have pain, arthritis, whatever, if my hands hurt because I'm holding my probes every day, what do? Percuss them. Pain is gone, right? Because what is the pain? Fluid, yeah? So you use a percussor to get that moving, pain goes away. Same thing for here. So after we open her and she's draining, we take a percussor to her foot, and then you're really going to see how much her foot changes.
Where can we get one of those?
Everywhere.
Yep, everywhere.
Everywhere. This
because
one,
you
can get
really
off the internet,
should have
right?
something like this. Oh, I know what you're talking about.
Does it have a long handle?
It does.
As long as it has a long handle, then that is called a percussor. This has a short handle, but it is designed as a percussor, so it's heavy. Ones that are battery operated do not go deep enough for me. They have to plug in. Okay, good. Because those ones that are battery operated, the battery's heavy. So the head can't be heavy if the battery's heavy. And what you do is simply sometimes I'll take like a sheet or a towel, put it over the area that I'm percussing so that it absorbs some of that percussion, and percuss where you hurt, where there's swelling. And when you take the percussor off, whatever area you're percussing softens, right? Changes shape because we are pushing this into open lymphs, which are designed to pull this stuff and get it out. Doesn't hurt, does it? Okay. So the company, I always say that I'm about to tell them they need to pay me something. The Wall Company, WAHL, that makes the clippers for men, has a long-handled percussor that you can get in CVS, which I actually love and tell all my clients to go get. It's got multiple heads on it, so you can change what you're actually using. Perfect. If you have that and it has a long handle, you may do that. You may use that. Sometimes you could take that Himalayan salt or a grapefruit oil, put that on the swelling, and then percuss it.
The one I heard is like I said, dual.
Yes.
It has two.
Perfect. Perfect. Very good question. I don't like heat when they percuss. He asked about heat. So heat relaxes muscles sometimes if you're in pain. But after a couple of minutes of increased heat, the body reads that as trauma. So what's the body going to do? It's going to swell.
So, I'm a client of my daughter's too. So I actually, 4 weeks ago, I fell. I was in a hotel and the bed was here and there was a step down to the seating area. And in the middle of the night when I got up to go to the bathroom, I said, oh, look at the lights. And we were right on the water and I missed the step. It was not pretty. And so actually, I was concerned. Right then it was okay, but a little bit later, I thought it was my rotator cuff. And I'm a right-handed. I'm a gynecologist. I cannot go and have a rotator cuff fixed. Sorry, I can't do it, God. So I found that I was able to lift my hand, and when I could do that, I knew, oh, thank the Lord, it's not a full rotator. So I do have a partial rupture of my rotator. I could not, when she started on me, I could not lift my hand. She stays with me when she's here because she lives in Atlanta, and so I've been getting my treatments. And it's amazing. It is just amazing. I was having achiness and pain at night. I couldn't even sleep. And for the past 2 nights, it's great. I mean, just amazing. She knows what she's doing.
Thank you, Mom. So I can actually push this now with my hands because she's open. And this is softening and liquefying, and it will move through. How's your ankle feel?
Good.
Good. And when we take her picture, we'll show you, because we took a before picture. We'll take her measurements as well.
And then, Barb, we'll be getting you up here after her.
Yes. Does anybody have questions about what we do this for, or how we do this, or questions about anything?
I have a question. Very important question.
Okay.
Does insurance pay for it?
No! That would be too much like right. We're actually making you better, right? Now, things like care credit, flex spending, or a health savings account, those things do. Those things do.
That's a good question. You know how long it took before Blue Cross Blue Shield would cover acupuncture?
Right. Forever.
Now they cover acupuncture, but and I think they've only been covering maybe about 8 years, something like that. It's just crazy.
Massage too.
But they cover lymphedema treatment. They cover
The kinds of things that you do here in the hospital, yeah, they do in the hospital.
But why wouldn't they cover this? So if you guys brought it here to the hospital, would they cover it then?
Well, yeah. We hope that and we have no bone in this. This is not our machine. But, I mean, we bought it, but we don't have any financial thing with it. But it would be nice if the hospital got it.
Absolutely. Absolutely.
That's the man that
It's not that expensive.
It's really not.
But it's so important
Yes.
to the health and
Yes.
well-being
Yes.
of those of us who suffer
Yes. Right.
from lymphedema and come here.
That's right.
For those.
And it's not only you, it's your practitioners.
Yeah.
This is, we were here, 3 years ago? Was it? I mean, and we were sharing it because it was like we were hopeful that the hospital would do it. for their employees. You know, really,
Absolutely.
because it's kind of like a no-brainer. Yeah, it is. Yes. Yeah. See, and these probes, the ones, the cold laser that she was using, we have bigger heads for it. You know, so we got longer heads. Like if you have large areas, you could use it the long way on the area. You know, so.
I have a question. When you were here before, was it the same machine?
Yep.
Wow. And I have to go back and look, but that's been over 5 years.
Oh my gosh.
Even longer.
Oh my gosh. And I just happened to stop in and see, it was God. You know, I happened to stop in and say hi to y'all one day. Okay, so she's putting grapefruit oil. It really, you know, let me tell you guys, we are amazed every day about what we see. Wow. I mean, really, it's like you look at it. I mean, I took her picture, and we are just amazed.
And this would not be considered a form of, I'm, in my mind, my analytical self is trying to figure out how we can code this to make it. I know, that's right. Yeah, because it doesn't make sense that this goes in line with what Janice does for me.
Yes,
when I come.
that's exactly right.
So this is exactly what she does, and these tools would help her not to feel like she's had a workout.
Sure, that's exactly. That's right.
And help me to heal quickly.
Yes, that's exactly right.
And so, yeah, I don't.
Yeah. Well, you know.
Well, God gonna work it out. I just feel it.
That's right.
Yep.
Look.
Yeah, let's do. She was sitting before, right? Yes. Oh, thank you.
So, in that head of the laser, that was the color that you used. What color was that?
No, there's no color to the cold laser.
It's just frequency.
It just happens to be orange. Yeah, but it's not. It doesn't have anything to do with color treatment.
See how?
I think last time you did something like a violet. Was it like a?
Yes. Yes. See how you're coughing? That's mucus breaking, right? So when we talk about the lymphs, I said to her, I said, you see? I said, you see how you're coughing? You know why you're coughing? Mucus is breaking. Yeah. Yeah, and we didn't touch her except to open her up here. But we didn't do anything with the microcurrent. The body is doing what it does. It's doing its job. What did you put on first? Okay.
Oh, here, I'm right here.
Oh, okay, good.
This was 2575. It's 25. This is in centimeters.
See the scar? Yeah. See, exactly. She was looking at her scar. Said, "My scar's almost gone." Yeah. Well, the body's eating up that stuff underneath.
Here's my next mole. Where's the other? Oh, Camille, you
The
got rid of
mole's
the
right
moles.
here.
Oh Lord.
Here's a big one. Here's one. Here's one.
Okay. She got rid
Here's
of
one.
She got rid of my moles.
I recently did an online class about scar tissue, and they were saying how.
Oh my goodness. This was 39.5. It's 38.
39.5.
It's now 38.
And she has not urinated yet, right? Which means as she gets up and starts moving, she's going to go again. Yeah. So you were doing, yes, they were saying what?
They were saying that scar tissue is so prevalent
Yes.
in our bodies,
Yeah.
and how people are oblivious.
Correct.
Well, some people, not all.
Correct.
But especially in the abdominal region,
Yes.
anytime you've had an incision or anything.
Or if you bump yourself, anything.
So people who are having surgery because their colon's been, just all the
There's-
from the scar
I have a lot of clients who come to me who are getting ready to have surgery because they're inflamed in certain areas who no longer need surgery after I'm done because this is taking their scar tissue.
Where's the next one?
Oh.
That's awesome.
So for,
Is that it?
Yeah.
what is that? For cording, have you ever run across any type of cording, any type of tissue where you can feel the lymph nodes?
Absolutely.
And that does the same thing?
Absolutely. Absolutely. Doesn't matter what the scar tissue's from, what the inflammation's from. You know, a lot of...
One more. Sorry, I don't have my glasses on. I can't see the little.
Right here.
I had a big mole. Now it's a little mole.
Lots of sciatic stuff, a lot of sinus stuff. People don't understand that this is very important up here. The body follows the head, right? And so a lot of what I see that's a buildup of scar tissue is related to the body not getting enough oxygen from the oxygen centers in the face. And so people are inflaming here and they're getting treated for heart problems. But if the problem is because the heart doesn't have enough oxygen, why aren't we treating this first? Right? Same thing. So when we open this, I feel better. So I open this a lot. Lots of people have issues resolved after everything, asthma, COPD, arrhythmias, lots of things that regulate once the body removes the scar tissue.
Well,
Okay.
you know, there's a lot of inflammation in
Sure,
the brain.
baby.
I mean, dementia
Yes.
inflammation.
Yes, absolutely.
Alzheimer's inflammation.
So I had a client who came in the other day who has dementia, and she could not remember where her room was. She didn't know what to do in the morning. She walked around in her pajamas and her tennis shoes because she thought she was going outside. We did one treatment on her. Next morning she woke up. She was able to turn on the TV, go in her room without being told where she was going. It's anti-inflaming.
Exactly.
That's right.
And that's a major cause of dementia.
Absolutely. And ADD and ADHD too. Same thing with those clients. Yeah.
How often should you recommend a patient or a client to come in to see you?
Good question. Depends on what they're coming for, right? The great thing about this is because you can never OD on it. You want to come see us every day, you can see us every day. It's not necessarily essential to do that, but we keep people on an every week to 2 week schedule, right? So the body has a chance to continue its own healing process in between. So depending on the severity of the lymphedema, every week to every 2 weeks. Yes.
How many visits would I have to look like Angela Bassett?
Yes. Okay.
How much is the machine that does
This?
one
The
that has
percussor.
Yeah,
So that one I used on you is $40. $40. And I'm going to give you the name of that machine if you want to look for it.
Yeah.
It is a sculptor machine. SCULPTOR. You get it online for $39. Sculptor.
That's the percussor.
Yes. So I'm going to tell you another. Oh, good. Okay. You want to do that?
Okay, guys.
Oh, can I just give numbers or not? Sorry.
Sure.
Top down, she went from 39.5 to 38. Then she went from 39 to 38.5, 31 to 30, 26.25 to 26, 25.75 to 25. And, so this is what people do like that. But, so this is just to show you how you see an immediate result. That's not the final result. Her body is starting to move that lymph fluid. And as she goes and urinates it out, it'll be even less.
Yeah.
Thank you.
Yeah, she just asked about that. And we said, unfortunately, traditional insurance, no. Things like care credit, flex spending, health savings, those things cover those. I don't know. She just asked about Aflac. Probably not. I don't know. But those other three, yes. Write it down.
I'm sorry, you're not local, right? You said
Yes, we're right up the street. We are right up the street on Greenbelt Road.
And when you say every 2 weeks, that this whole process is called the Jade.
Correct. Yes, correct.
So what is the address of the street?
9811 Greenbelt Road, Suite 104.
I remember now. So after the patient or the client has their treatment,
Yes.
is there a recommendation that they should like drink a certain amount of water?
Lots of it. Lots of it. So I always ask people how much they drink anyway. But the idea is water stimulates the lymphs. So I always tell people, you want that to go, you have to give your body enough water to pee that out. So minimum, you're half your weight in ounces. Minimum half your weight in ounces. I'm telling people, shoot for a gallon. You're not going to get there, but if you get halfway to 3/4 of the way there, you're in really good shape. And I always tell people, the more you drink, the more you pee, the better you look, the better you feel.
Well, that's the gas.
Okay, so could you tell us, like, or maybe around about how much this machine is? Just one last question. How much this machine, the Jade is?
I do not know, but I will find out for you.
Okay, so we're going to transition. I'm going to give Mitch a couple minutes here just to kind of go over FlexiTouch if you guys are not familiar with a compression pump device. And then I'll get ready for you guys.
Thank you. All right, how's everyone doing today?
Great.
Good? Well, I appreciate the time. This is awesome because it looks like we're all on the same page when it comes to lymphedema, the lymphatics, and essentially that, stays with us for the rest of our lives. But that doesn't mean that we can't manage it. So what's great about at-home therapy is that once a day, every day, we're all human. If you skip a day, not a big deal, as long as you make it part of your routine. At-home therapy is really important. Everything's in conjunction. We have lymphedema therapists in the back, right?
Mm-hmm.
So how would you like to bring them home? Basically, this is what it's doing. This compression device, if you want to pass it around, it's incredibly simple. You have one amazing. Is it the FlexiTouch or is it a different? Awesome. And so insurance-wise, it is covered by over 800 nationwide, which is amazing.
So you need a prescription?
Yes, you do. Okay. You do. So the process is very simple. We work with lymphedema therapists, doctors, rehab facilities. Essentially, once they give them a referral, we go and own the process. We meet with the patient in the clinic, at their houses, and just for them to try it on before they ever commit to everything. We all know that healthcare can be, it can be expensive. So by giving you a little test drive of what it is and what it can offer, that's just our gratitude to you guys. Whether it's lower legs, post-operation breast cancer for the shoulders because it can be heavy, picking up groceries, picking up kids. We want to make sure that we are stimulating those lymphatics. Head and neck cancer as well. Patients that are having trouble swallowing or even eating food. We're able to
Trying to stimulate that?
stimulate the lymphatic channels. So essentially what this device is doing, it's inflating and deflating in a very systematic motion, really just opening up those channels. Because our lymphatics are so close to our skin, it doesn't take a lot. But the way we're able to do that, very, very beneficial. It's helpful with the patients, huge compliance rates, satisfaction because the patients are seeing it. They're seeing the results, they're getting it at home. And if we're able to make it as user-friendly as possible, that's what's going to drive compliance, honestly. That's a little bit about what FlexiTouch is, the pneumatic compression device. I have a little booth over there with the garments of head and neck, shoulder, chest area for the breast cancer patients, as well as lower extremity for more of CVI, the vascular disease, with that dermal backwards pulling on the legs. If anyone wants to try it on, we can hook it up over there and just so you guys have an idea. But if you guys have any questions, please do not hesitate to ask me, okay?
Thank you.
Awesome. Thank you, guys.
Thanks. Mom, did you send Barbara somewhere?
Yeah, Barbara's here.
Okay.
Okay. So what we're going to do is, let me tell you about pain. What I was going to do was I was going to have her stand, cover her up. Maybe when she comes back in, cover her up so she can take her slacks off here, wrap it around her, and then lay on the table, okay?
Mm-hmm.
So, this is the thing about pain, what happens with pain. It's an inflammatory process as well. When we have an injury, what happens, our body, God put everything in our body to heal ourselves. the thing is, we're detrimental to ourselves, so we don't do the right things with it. So when the things come into place to fix things that we've messed up, we don't have the resources in our body for it to work right. So when we have pain, natural things come into the area, are sent there through the blood to heal those areas, including white blood cells and things that are going to take things out and to help the pain, okay? And so those things come into place, and once these have been going into the area to heal it, the lymphatics are supposed to take the stuff away. The problem is, the lymphatics are so clogged, they can't function, so the stuff stays there where the pain is, okay? And people just still have pain. I felt it in my shoulder. I wasn't getting any treatments because my daughter wasn't here. And so I was sore. I couldn't sleep at night. It was terrible. And so those things stay in that area, and you just don't get better. You don't want to move it. You know, when you have something that hurts, the worst thing you can do is to splint, because if you splint like, oh, I don't want to move it, what happens?
Sends more fluid. Mm-hmm.
You know, so you got to move it, all right? So what we're doing again is lymphatic drainage, okay, to get the lymphatics to be able to move, and we're going to work on the area on the hip that is painful, treat it very similarly, okay, and I can almost guarantee you that she's going to get off the table and say she feels better, okay? It's just remarkable. We have a little extra things. Did you bring the infrared?
Yes, I did.
Good. So we're going to do something a little bit different. Can you help her get up? And then she's going to lay the same way, right, Camille? It's her right hip. So we're going to, okay. So,
yeah.
Yeah. Okay, so we're going to use
Okay,
another little
let's
device.
see. Which hip is it? It's the left hip? So I'm actually going to have you lay head here, and your legs will go over there.
Work this.
You can get up.
So it's her right hip, right?
Left hip.
It's her left. Okay, good. So perfect. We want you so the left hip is over there.
Yeah.
And use. Okay. Yeah, help her. And I'm gonna drape her left leg. Okay. Are you comfortable? Okay. Good.
Hold on. Let's put this under her knee.
Okay. Put this under her knees. Okay.
Yes.
Great. I'm gonna drape this.
I'll just hold it.
All righty. How much do you charge for treatment?
I have people ready to come to you.
Janine's ready.
I'm ready. I'll be there tomorrow.
Okay. So, there we go.
So, before, are you touching that again? Listen.
No, I didn't touch it.
All right. This hurts, right?
No, it's the left.
Oh, it's over here.
Yeah.
Oh, it's the left leg?
Yeah. This is good.
Okay.
All the way up. Where's
Yeah, it's
most
like
of it?
right in the
No,
ball and
just
socket.
Don't get that. Don't get that. Just get region same back and do it.
Okay.
Yeah.
Will do.
All right. Where do you feel most of your pain?
Like right in the front.
Okay.
So that's one thing that I like to ask my clients a lot. Y'all need to pay, y'all, that's what I'm saying, us, everybody, needs to pay attention to the signals your body gives you. Your body, 100% of the time, will tell you what is wrong with you, and it will tell you where something is wrong with you. We can't ignore it. People are like, oh, I got a little twinge back there. No, you didn't. The body's saying, hello, there's fluid back there that you need to do something about before I send all this fluid there, and then you have a problem. So I ask my clients all the time where their pain is, because I can't help you if you don't point me to the problem, right? I'm not a psychic. I don't know. You can tell me what your diagnosis is, but I need you specifically to tell me where your localized pain is. And from there, then I can feel it and go to other places. So I just asked her where her pain is localized, and it's really here, right in towards the front, yep.
I was looking for the code. Oh, there it is.
Okay. So when I rub her there, I feel these little, what I call them either crunchies or these little jelly balls, right? And you all can do the same thing. Sometimes test yourself. When you feel pain, take your fingers to where you feel pain and rub across the muscles and the tendons. Many times you'll feel little bumps. You'll feel what I call little crunchies. Those things shouldn't be there. And oftentimes, firm massage or percussion will handle that issue. So if I wasn't doing this for to make this an example for you all, I could literally take the percussor a little bit and relieve her, right on top of where she hurts. And since my mom has the cold laser, that's lovely, I'm actually going to do that while my mom is doing that. So, you say that you hurt here. I want you to tell me if this is too much when I put this here on you, right? Can you feel pain here currently?
Yeah.
Okay, feels tight and stiff.
Tight, yeah.
Okay.
So she has, for those of you who don't know, Barbara has what we call kind of hip dysplasia. That is, she has something that's probably congenital that didn't get fit right in the hip, in lay terms. Basically, that's it. So over a period of time, as she's gotten older and something doesn't fit like it really should, it wears the wrong way, and then you end up with pain, and now she may have to have something reconstructed, okay? So I just opened up her thoracic duct. That's the biggest trash can in the body, right? Now I'm gonna go underneath her arm here.
Does that feel looser?
It actually does.
See? How long was that? A minute, right? And all I did was use the percussor on that area she pointed to that hurt, right? So we're letting her body do some of it. We're letting the percussion do the other part. And when she stands up, her gait will be different when she stands up.
This is phenomenal for pain.
I should have been over here first. I told you about my neck before she got over here looking around.
But I tell you, this for pain. We have people get on the table and get up all and so much better. You can hold that.
Looser still, Barb?
Yeah.
Yeah. So, those little jelly pockets I was telling you about, that's what I was feeling for. When you percuss those, that vibration is breaking them and that fluid starts to move. Right? So she feels better. People who have sciatic pain, you must have a percussor. You must have a percussor because you don't need another person. You have that long-handled percussor that you hold where you feel pain, right? And let your body talk to you. Let your body tell you where the issue is.
Hey, we should do this together a lot.
I know.
I can do the lymphatic drainage.
Yep.
The teamwork here. And what is that you're using? Is that
that solution is that little bit of mango butter I was telling you.
Mango butter.
Eucalyptus. There's eucalyptus in there.
Okay.
There's lavender in there. And normally for pain, I'll add some Himalayan salt.
Do you sell that? Yes.
Yes, I do. But I told you and I promised you I was going to tell you where I get my oils from too. There is a very easy, and you can ask my mother, very, very easy, very effective pain combination. Peppermint and grapefruit oil. Mom, how long does the pain take to go away?
Oh my gosh.
Instant.
Oh my goodness.
It's instant.
Wow.
And it's essential oil.
And what's the ratio?
So I put in 2-to-1 grapefruit to peppermint.
Okay.
Okay.
2-to-1.
And then in a base oil.
No, very good question. I'm glad she asked about that. She asked about a base oil or a carrier. So this is the difference between essential oils. Pure essential oils don't need a carrier. Okay? So the oils that I get come from an oil wholesaler, so you don't need a carrier. Most of the time, if you need a carrier oil, it's not a pure an oil as they say it is. Okay.
We use St. John's Botanicals. They're right down on Lanham 7. Lovely spot. Lovely place.
Where is it? Right here. You'll feel it right in here. Where she put her hand, you felt that soreness? That's the other thing. It helps if your providers actually touch you. So, some people, I have clients who are like, well, yeah, my doctor said I had this. I said, well, how did they know? And I said, did they touch you? No. Well, how do you know?
Exactly.
You're not there. We're all individual people, right? Your doctors need to touch you. to help you figure out what your problem is.
When I went to see my orthopedic, I really love him. I really do. And so I went to see him about my shoulder. And so he said, "Oh, Carol, so what'd you do?" So I told him the story. And so he said, "Well, how much can you lift your arm?" And so I could only lift to that, right? And he never touched it. Oh, it's a rotator cuff.
See?
You'll probably need to have surgery for it. See?
Oh my goodness.
See? What? See? So
See?
listen, they don't treat us any different.
Because you're a doctor, huh?
Right.
Barbara, how's that feel?
See, it's painless.
Yeah.
No, painless.
So, how many of y'all are going to be impressed if she gets off the table and doesn't hear her crutch?
For real.
Okay.
I can't wait.
Okay.
Back to work, Barbara.
That's cool.
Is boss still here?
No. I already told him.
That's why I said it.
And I'm here. He had a call. He said he really appreciates you coming out, and he had to go.
Okay. So I want to do one thing before we do that. So if you lifted this up before we started this, we lifted your knee. Would your hip hurt?
If you rotate it.
Okay.
If you would rotate it, yeah.
From even if you were laying on the side? Or
Yeah.
just if you lifted it by itself?
I can lift it by myself, but if you would manually
Mhm.
rotate it,
Gotcha.
and externally rotate it, oh
Gotcha.
my God.
So the other thing about how in tune the body is, the body's amazing. The body never stops fighting if the problem is still there. So congenitally, if you're born with something, guess what your body spends its life doing? Trying to heal that problem, which means a lot of fluid, a lot of inflammation, a lot of pain. If you remove that, and the body says, "Ooh, we're healed," let's see how she feels when she gets off the table. Okay, so we have another little machine here. So because she has pain, infrared stimulates cellular activity, right? So we speed it up. We want the cells to heal, we heat them up. So we have a combination. I will do the Erconia, and I will also do a separate infrared device because she has pain. Most of the time, if I use the Erconia on people who have pain, their pain pretty much goes away.
I'm gonna walk y'all.
Does your pain level change when the weather changes? Right. Fluid. Vibration. Right? All the people are sick and people have a lot more problems in their body now. Why? Because the weather goes from 70 to 40, back to 80, back to 50, which means if that barometric pressure can't stabilize, neither can your immune system, which vibrates. Right? So when there's weather changes, significant ones, I always tell people 3 days before, 3 days after a significant weather change, douse yourself with water. Water, 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 and nothing
Like a tub bath?
water, drinking water.
Oh, drinking water.
Drinking water. Himalayan salt baths help. That too. To
That's a
remove
lot
some
of
of
salt. How much salt do you have to have?
So, and this is, I'm talking, if you're using the crystals, those are good to put in the bath. Fine salt is what you want to use when you're putting it on your body. And like a cup and a half of salt.
Did you
Hot.
bring any salt?
Yes.
We did?
Yeah.
Yeah, we should have put some.
On her before we started. So you know that Himalayan salt works like that because it's got what? A bunch of minerals in it, right? Which is what the body needs to heal. What do we think is in the Dead Sea? A highly concentration of mineral salt, which is why you go in and you float and you heal, because the body gets what it needs. That's very similar to Himalayan salt. Lots of minerals. Yes.
What about Epsom salt? Is that
So Epsom salt is better than table salt because there's no sodium in it. But Epsom salt is not naturally occurring in the world, right? It's not. It was made Epsom. It just doesn't have sodium in it.
You're welcome.
But really, if for those of you who have swelling, and this is for the therapist too, you may want to recommend to your patients to get something like pink Himalayan salt, either a salt stone that they can rub on their bodies after they get out of the shower. They get after the shower mostly.
Some people do it in the shower. They have salt rocks, and they actually use it in the shower when your pores are open, and rub it on your wherever you're swollen.
And because it draws, you know.
So do you rinse it off when you?
Yeah, you don't want to leave it on your skin.
Yeah, I mean, you know, like you rub it on first and then take a shower.
Well, if you're talking about the salt stone she's talking about, the salt stone is actually a rock that almost acts like soap in the shower. So as you're using it, you're gonna rinse that off in the shower. You don't need to do another rinse once you get out, right? Because it goes into the body and is rinsed off.
I'm going to get everything.
I mean, and also there are the salt lights, and I have
The lamps.
them in my
Yes.
house, and you know you can put them in the room, and that's going to also just kind
Do
of
you
like,
know why?
Yes. You know, what is it?
It kills the negative ions in the air, right? Which
Right.
are what carry free radicals. Yes.
Yeah.
So the salt, when you heat it, like your blood flow heats it and activates it. That's what those lamps do, and they kill bacteria in
It
the
does
air.
make the air dry and for a long period of time.
That's another thing I forgot to tell you about was free radicals. So when our bodies eat food, the breakdown of those foods are free radicals. Free radicals then are in the system. And so if you don't do anything to eliminate the free radicals or something to balance it out, you got those things hanging around in your body. And combustion of cars, they make free radicals too. And that's so all the stuff that's in the air, we are breathing in those things. That's why we really are generally contaminated, you know. There are some things like fruits and vegetables that make very little free radicals, if any. That's why they're better for us to eat. And you can go into Google and look up anti-inflammatory diet. And if anybody know about the restaurant True Food? True Food, there's one in Bethesda and one in Fairfax. The food is delicious. It will be things you have never seen before. And it is all anti-inflammatory eating. Dr. Andrew Weil, W-E-I-L, in Arizona, is an MD and really kind of like a naturopath too, but some of you may know of him. He's wonderful. And he actually was the one that they were consulted for these restaurants, okay, True Food. And it is divine. And I haven't been to the one in Bethesda, but the one in Fairfax, when the weather's nice like this, they have outdoor seating, it's in an area, it's lovely, very lovely, and the food is delicious. And when you go there, ask at the front desk for their little brochure about it, because they used to have it out. They probably spent too much money on it, but they do have it there, and they tell you the story of anti-inflammatory eating and how this came about. But that's the kind of eating you should do.
Is it mainly raw?
No.
No?
Yeah.
And if you know other things, of course, herbs, teas, all of these other things, who knows what the moringa tree is?
I do.
Yeah. Very good.
It has all the vitamins you need.
It has 46 antioxidants in it. The moringa tree has the most nutrient dense, it's the most nutrient dense herb leaf in the world.
Bermuda.
Moringa.
Bermuda.
What about Bermuda?
That's where they are?
No, well they're known in Asia and Africa and India.
So we went to Bermuda a couple of years ago.
Moringa. No, that's not the word.
Never mind.
He just told me what it was.
Yeah.
Cross that one out.
Moringa. There is a moringa powder that you can get in Whole Foods. You can put that powder in a smoothie, a drink, whatever you want to put it in and drink it every day.
Does it taste like dirt?
I was about to say that.
You can do capsules.
It doesn't taste like dirt. It's thick though. So what I do is mix it with some pineapple juice, a little almond milk, some bananas, and a bunch of fruit, and ice. That's the key. You have to put ice to make it not thick.
I've seen the drink.
And they have it at Costco. They have the moringa powder at Costco.
Yes,
I've seen that.
good.
I didn't know what it was.
And you do moringa coffee every morning.
I know I do the Ganoderma, or the Ganoderma, Organo Gold
Yes,
coffee.
yeah.
Yeah.
Yeah, in regards to free radicals, I totally agree with Dr. Mussenden. I actually read
Talk
an
a little louder.
article. I read an article. I said I totally agree about the free radicals with Dr. Mussenden because I read an article where it says there's so many toxins in our car.
Yes.
And we don't even realize it. So when we get into a car that is hot and been sitting all day, we're breathing all of that. All of that stuff. The seeds, the plastic that is made from toxic materials. So they say the first thing we should do is crack your windows. Or drive with your window down. Yeah, we're breathing that. So yes, we are walking. Thank you, Lord, for providing us the ability to kind of filter, you know, because if not, we would be toxic waste.
The other thing is, when y'all come home from work, outside, wherever you're coming from, don't take your clothes off in where you sleep. In the room you sleep. Do not take your clothes off in your bedroom, because you're bringing outside to your bedroom, and then your inside becomes your outside, and you have no reprieve from the outside. Okay? Do not take your clothes off in your bedroom.
Yes. Here, I've heard people years ago that say when you're sore, if you soak in apple cider vinegar, that's what's up with soreness.
Very anti-inflammatory apple cider vinegar. Yeah,
That's why you hear people talk about drinking it every morning.
Tastes nasty.
It's horrible. I drank it one time, and the acid was so bad on my throat for 3 hours.
Wow. It's great for sore throats, though.
Yeah, it is.
Yeah, it'll kill
so
everything.
is salt. Gargle Himalayan salt.
Okay.
But for those that have GERD, I don't think that they should.
I say gargle, not GERD.
Yeah, that's too much acid. It's really hurting. Yeah, I can't. Where do you feel? Well, you know, some of the things they tell you just put gas versus Jade. Gas versus
Did you hear what she said? She said she's surprised she could do that.
Wow. External rotation.
Let's see a cartwheel.
That'll tell you, right?
She's like, I couldn't do that before. Mary, let's turn uniform ready.
They want you back.
Miss Perkins, I need you back.
Good job.
Yes, I did. Now, would it be easier to try to manipulate your hip on the side while you're on the table? Try it. And tell me if you feel pain.
Not hurting.
Good. Would you normally feel pain on this side?
Yeah.
You would? Lovely. Now that you're on here, let me do this side first.
Wow.
I asked her would she normally feel pain in this position. She was like, oh yeah.
Oh, yeah. What about, you guys talked about grapefruit being an
Inflammatory?
What about pink grapefruit? Same thing? So do you, we're talking about rubbing the Himalayan salt like on the trash can?
Yeah.
Would you do that for just every time you had pain in your body, or you put the
Very good question. So I tell people to do the salt here if you have breathing problems, asthma, COPD, mucus, sleep apnea, don't matter anything. Wherever the pain is on your body, take the salt and put it where you have pain.
And is it like how you gave us the ratio for the essential oils? Do you just take a scoop of it, wet it down?
So a scoop is a lot of Himalayan salt. I take a small handful. Small. Because once you put it in your hands and it activates, yeah, like a pinch, and then spread it, it spreads. If you take a large handful, you'll waste it.
And do you add water to it?
It just needs your blood. It just needs your blood, that's it.
Wow. So you don't need to make a paste or nothing. See, I was already over here like the science kid.
Nope.
And so how do you know when to take it off?
Good question. It only takes like 30 seconds to work. I tell people if you want it to work well, leave it on for 5 minutes. You can leave it on up to 10, 20 minutes. I use it for the babies too, as young as 6 months, 1 year old that have the mucus in their throat. It's the same thing.
Oh, that's right.
Okay, now you can turn back over there. All right, now I'm gonna have her get up in a minute. Do you feel any tightness or pain anywhere?
Lovely.
Okay. Oh yeah, we don't want her falling and breaking up.
And everything.
I just told her, I was like, have you ever had your lymph system checked out? And she was like, no.
When you
See, she said even getting up was easier.
when you ever have treatments and things like this, you really ought to, especially with what your practitioners are doing, you really ought to be careful about getting up suddenly and just getting up and standing up. Because you know, we're moving lymph fluid, opened up things, and you don't want to get dizzy or anything. Also, you're gonna need to drink a lot of water too. Okay. All right. Okay. Let's see here.
I got this.
There's a question back here.
I got up and there's no pain. Normally when I stand up straight, it feels like it's gonna dislocate. I didn't have that sensation. So
Wow.
She's standing straight without flexing her knees.
Yeah, can you walk?
Oh.
Carefully.
Hi.
No crutch, right?
That is awesome.
Wow. Now I'm gonna give her crutch back because we didn't. Yeah, I'm gonna give her crutch back because we didn't do a full treatment on her. But she probably gonna need it.
Yeah. Amazing, isn't it? Yeah, no, we feel the same way.
Look at you.
Need it? That beautiful spa on the top floor.
We're downstairs now.
Okay.
But that is still ours. We just have a naturopath, 2 naturopaths up there.
Yeah, we have 2 naturopathic doctors, women, who practice above us. So where I used to have my operatory for liposuction was on the 2nd floor above our office. The laws in the state changed, and I could no longer do liposuction in the center. And yeah, but you know, it really did take a lot out of me. I tell you, it was a physical job. But so anyhow, it looks like still like the same spa. It's really lovely.
It is
and they've
lovely.
done some changes, and they have the entire spa upstairs.
Does the patient need to prepare before coming to see you guys?
Very good question. So do people need to prepare before they come in? Actually, no.
Water?
You know, they can drink water, but you know, they're bringing their junk in so we can get the junk out. So.
What's the phone number?
301 552 1111.
Oh, wow.
No, it's not there.
We are down. We're near, you know, Dr. Gavin Michael, who's a pulmonologist here. You know where his office is? We're right next door. So we're the
Across from Duval.
Across from Duval.
Oh, okay, you're near the trade centers, right?
Mm-hmm.
No,
No,
we're
not
near
that
the
far.
trade centers.
That's Roosevelt you're thinking of.
We're right here. We're right here on-
Duval, right, I know
yeah,
what you're talking about.
We're right here on
Okay.
Livermore Road.
Right.
Not Eleanor Road.
Yeah.
So, yeah, so, what kind of questions do you all have? Yes.
Camille, where'd you get your shoes?
You know what's funny? Everybody has been asking me. My brother lives in Brazil, and there is this. She's a shoe designer.
It's Melissa's. They're Melissa shoes.
But they're plastic.
Plastic.
She's known for like these plastic shoes, and he's coming here in May, and I'm like, you've already got 6 orders to come back here and bring me shoes. So yeah, she makes these little plastic.
Are they
shoes.
comfortable?
Very.
Okay.
They're plastic.
Thank you.
And they're expensive up here.
Yeah?
Yeah.
Oh, they do sell them here?
Yeah, they're
you can get 'em
expensive now.
online.
Okay.
Yeah.
So I have a question.
Yeah.
For a person like me who is stage 4 lymphedema, who has lobules, how would this treatment affect that? So as Janice told you when we were coming in, I would have to have skin reduction once all my fluid is gone because it's been there for so long. And
So I see a lot of people like that. And I have found that if you rid the body, the combination of removing the fluid while we are using percussion helps to tighten the skin while we are doing that. So I have a number of people, for instance, who come for after having gastric bypass, and they're like, I don't want to cut my skin off. So we do the same thing on the skin.
Further complications with lymphatics, because you're removing lymphatics.
Yeah,
Exactly.
that's not a concern.
Exactly.
But
So-
and she and I were just talking, and percussors could be good
Yes.
for you all to add.
Absolutely.
Some nice percussors.
If you get a percussor at home and regularly, yes, you have one, and regularly percuss yourself, you are stimulating those skin cells while you are percussing.
Yes.
So it's maintenance. You're doing things to enhance the tightening of the skin.
Yes.
So sort of like the derma rollers kind of thing?
Kind of.
Yeah, kind of.
But the derma rollers
They're
don't
not
go
percuss.
deep enough.
Okay.
They don't go deep enough.
Yeah. There's a percussor that this company makes, the Ricconia, the percussor they have. And it's really great, but you probably wouldn't get doctors to get you one.
How much is that one? About
Thousands.
hundreds? Oh, thousands?
Yeah, it's probably.
But you,
probably.
but I think this is, it's so amazing that there are things out there like this, but because of the system and how it works.
Correct.
So, just to be able to expose, especially in PG County, because we know we can go, to other places and get these products. So, it's, I just feel really grateful to have been here to see this.
Well, the thing is, I think if you all, just something simple like the heavy percussors can make a difference. And you can get the percussors.
Can we feel that? How heavy is it?
Yeah. Sure. But that one is
This is a small one.
That's small.
This is a light one.
That's lightweight. For somebody like her, I would use one where you've got some weight on it.
They have some that are big that have handles on the side that are not super expensive that can cover an entire back, an entire arm.
And the percussors that are like that we're talking about that are weighted, but see, you probably ought to put some
I'm getting some treatment.
She was treating and put a foot on her shoulder today.
But the thing is, talking about percussors, and guys, for you all who are the practitioners, something like you've seen the heavy percussors, where you can literally put your weight into it. You understand? Because for the degree of that she has, she needs some hard pressure.
Right.
And human beings just don't have, I don't care whether they're men, just don't have enough to get down there.
Right.
You do start doing something like that, I bet you'll move her quicker.
Right.
You see? And something like that you all look into as well. You can look at these things online and see what you can find. But Camille, the ones that are the heavy ones like this, you have any idea around cost?
About 180. The ones with the heavy is not.
And for somebody like you, who's it's a long process, it's gonna be a long process, maybe worth it. So, but you can find anything on Amazon.com. So you just look up.
Is it like this?
Is that right? Did you see my head?
That's
starts
exactly
going
right.
around?
Oh, look at this, $149. Look at this, Camille.
One percussor in our department.
Look at that.
See, that's what I'm talking about. The ones that are ones
That's
that are.
excellent.
So it looks like a
jackhammer.
Yeah.
You all get several of them down there. You'll save your body.
I know that's right. Hey, look, let me give you a hug. This was saving my body because I've been here 14 years.
But yeah, you gotta think of that. That's excellent.
That looks like something you can label on.
How about that?
Question, Mom.
Yes.
What did you say about the scar tissue after we get from surgery?
Oh, scar tissue? So this is the thing. Camille has done a lot of work with scars. Scars are, you may see scars on the outside, but they're affecting the inside. And so when we see scars, we treat the scars, try to eliminate them, because you were then breaking up the scarring underneath that tends to pull on tissue. And this was something I didn't know that I didn't know, because my naturopathic friends and my herbalists years ago would say, oh, that scar has got to be fixed. You gotta work that out.
Because I wasn't here the first one.
It's a percussion percussor, so it just kind of mimics like a massager in a way, but it pulsates a little bit. It's actually really nice.
When we think about how intricate the body is, and how we have nerves that are not only inside but outside, and they're connected to all the different nerves. If you got something, a scar here that's got nerves in it,
Thank you.
and you have scars, that goes down to the other nerves below it, you can get irritation of the nerves, which causes pain, right?
And the body and scars are trauma to the body, so the body keeps sending fluid there until that scar goes away, which is only unless you go inside.
Yes.
So like, our patients, especially for our patients, breast cancer patients, whenever they have a surgery, should it be like an automatic thing for a referral to go to come to lymphedema clinics, even though there's no symptoms of it?
Yeah, it's gonna have deep, they're gonna have deep scar
Absolutely.
tissue.
Yes, it is.
So all the breast cancer patients?
Yes.
So the only thing is, we don't take HMOs and we don't take, I think that's it. That's it. We don't take HMOs. That's the only thing. But at least for an assessment, the recommendation, I'm just gonna say for the National Lymphedema Network, which is the national organization that started the whole information about lymphedema. Yes, the recommendation for breast cancer related lymphedema is that they're measured before surgery, and then after, within 30 days after, and then subsequently every 3 months is where the standard of care is. Okay.
And then another thing about scars, and this is something that everyone, all of you practitioners can recommend to your patients. Scars, especially fresh scars, should be treated routinely with arnica gel. Arnica. It's an anti-inflammatory. You see? A-R-N-I-C-A. Arnica.
Back on the 30th.
You get it in the drugstore next to the pain
From the
medications.
30th to the 6th.
All right,
I'll be here.
you can find
And then I'm
arnica
here. I
plain,
work Saturdays
arnica
and
with
Sundays.
lidocaine in it. But if they use, once the wound is.
Is that the one you're using too?
And
That's what I
even
was
if
just using.
the stitches
Okay.
are out, then just use some arnica on the wounds. That will help that, because it's uninflaming the tissue.
It's at Target.
Yep, every drugstore.
So when I go
Where
back,
you get the pain
I'll
rubs,
be here from the
the
30th to
icy
the
hots
6th,
and the
and I'll be
light
back
topical
on the
lidocaine.
6th
And by the way, y'all,
the 13th,
practitioners,
and then I'll be there
when you have
after.
patients who have
That next
pain,
week.
you can get 4% lidocaine over the counter. They can get that if they have pain somewhere. They don't need a prescription. That used to be by prescription only. You can get it on Amazon.com. Yeah.
Other cancer patients, is there like a recommendation for them to visit?
That's the stuff
Depends
she's
on
using
the
too.
clinic or.
The little hammer looking thing.
As needed.
Like the massager thing up there.
Oh, yeah, you know what, we had thought about that.
That's what I'm
I
saying.
do, I do everything else. So, I want my patients to experience the same thing.
Can you say that?
I put in my cart.
Yeah, that's right.
Other, like, definitely, cervical and down there.
Yeah.
Any
Exactly.
cancers too.
Any inflammatory,
Any
anything,
inflammation.
and everything
Starts
is
with
inflammatory.
inflammation.
So I would actually like to, could you introduce yourself?
Yeah.
No, our
them.
patient, yeah. Because you came in late. Oh, introduce ourselves.
Not the only
one. And we had a couple of latecomers that came in. I'm sorry. I'd like to introduce the thank you, you didn't hear. And also,
Are you a patient?
yes. And she has some scar tissue, right, that we're trying to relieve.
Really?
Deep scar tissue.
that's considered deep scar tissue?
So she has lymphatic congestion is how I would describe it. Yeah, it's lymphatic congestion with some scar tissue.
Do you all use arnica in your treatment therapy?
No, but you know, it's all.
Let me tell you,
I can get it.
arnica for your patients.
Okay.
You know, you all are doing deep massage. Deep massage, and that arnica can really get down under the tissues. It's a gel. Your patients will feel better. You ought to order it by the bucket.
I know that's right.
Margaret without the crutches.
Yes.
Well, we can buy it, but you could buy it. Yes. It's on Amazon. Walmart.
While you massage, like when you massage with lymphedema, what do you put an element on the skin?
It depends, but generally we'll do some like free up if there's some deep, we do some myofascial release. But generally, it's our hands.
I use shea butter.
But
I
don't we
use
know oils? Nothing.
cocoa butter.
Some.
So my,
I use
you know,
a
and
lemon
we can talk
savvy.
to you all about it later, Camille in particular. But you ought to be using some oils with that stuff. I mean, gracious me, some grapefruit oil. She can tell you all. I think you should talk to her.
Yeah.
Because that, well, first of all, it's a medium to massage. I don't do anything dry. I'm using something that's going to fix the problem that they've got.
Right. Now, when I'm going deep though, and I don't want anything holding me back, because I'm trying to, but that's all I know. That's all I've ever done is with my hands.
Right.
So
y'all are superheroes.
With my hands.
Our training doesn't go through. I mean, with our training, they want us to have the dry hand on the dry skin. What? To move the lymphatics.
That's the traditional.
So you're saying that's not the best way?
Well, first of all,
it's hard.
It is.
It's hard.
Yeah. Say it again. It's
we're all breaking down.
Secondly, it's painful to them. I mean, to you all. And if you're doing that kind of deep massage, what are you talking about? You mean you're not using something like deep arnica to get that in there, or lidocaine topical for sound?
And the thing is, if it's scar tissue too, you're putting an oil on that's softening that. It makes your job like 100%.
Well, with scar tissue, we do add a little medium, maybe like some shea butter or like a lemongrass oil. You know, the hospital uses a lemongrass base, beeswax, lemon.
That's still thick.
Yeah, it is a little thick, but it smooths on nicely.
Very.
Lanolin, it's like all natural products. We have a lymphoderm for lymphedema that a lot of our
and the oils use. Are in that one.
But that's not; those are not therapeutic oils. Those are just mediums to make it slide a little bit.
But this is why.
But you
it's
guys,
not only for the patients, but for the therapist to make sure that we can enhance our skills. That's
you
what
guys
we
say
do
that the lymphatic nerves are fragile. They're on top, right?
You have superficial and deep.
Right. Right. But so when like for my stomach massages, when we're doing this and then and then this way, are those type of would I use oils for those type of massages?
Yes.
Okay. Where we're just trying to move. Okay.
Yeah. And depending on the combination and the oil, before you even touch, the oil's doing the job already. The oil is removing that and softening and stimulating those limbs. Absolutely.
Wow.
Absolutely.
Are there stages of lymphedema? Because I heard the young lady say she
Yes, ma'am. Yes, ma'am. There are stages.
Well, I'm not. That's not. I don't use that lingo because this is not my specialty. They're the experts. But I would say, based on what you have, yours is low.
Well, when you elevate your leg, does it go down?
Yeah.
So you're going to be in a very mild stage. You're going to be like at stage 1, 0 to 1.
Yeah.
You know, stage 3, 4 is when you elevate and you can't. Nothing's going to happen. Even at stage 2, I don't think anything happens.
It reduces, but it doesn't go completely away.
Yeah. So when you elevate, that probably means you have maybe a mix etiology of vascular and lymphatic. You know, and possibly it may not be all lymphatics because it's a brother and sister team that's working.
And my second question is, as soon as I leave here, I'm running to glutes. to get a big something rather of grapefruit oil. But what I'm wondering, Glut's glued.
That's where I get my mango butter from, and they have the best. The Glut has the best.
So this is what I want to know. Do I, when I go to sleep at night, do I rub my leg with the grapefruit oil?
Yes.
And when I wake up in the morning, do I rub again?
You certainly
Mount
can.
Rainier.
You certainly can.
I put my-
And if you add a percussor to that,
Oh, I got that down there. Right there. I'm ready. Because I'm going to get them sandals and I'm going to be switching.
then you are good.
So I want you to introduce yourself.
I'm Karen, and I have multiple situations, but I have lymphedema in both my legs, and I haven't been really able to get manual work yet because I have crappy insurance. I have Medicaid, so I don't know what is covered and what is not. So far, I haven't been able to find any coverage. But I do have the pumps at home, but I also have like chronic systemic pain, so I'm
Sure. Is it easy? Is it comfortable for you to get in tubs?
I can get a tub, yeah.
So soaking in some Himalayan salt baths would help you a lot. A lot. Since you can't get any of the manual stuff, you get that oxygen moving and that salt in the body, that will help a ton with your lymphedema in your legs.
How much salt do you need? Because I have the bag at home.
Mm-hmm. Is it coarse salt or is it the fine salt?
It's a blue bag, pink.
So it's probably the fine salt. So I say, if you're generally in good health, it's crystals. So if it's crystals, you want to put like 2 cups in there. If it's crystals. If it's the fine salt, you can put, I would say for you, 1.5 cups. Yeah, and you soak in that. Sit in there for about 15, 20 minutes in the salt, and your pain would significantly abate.
I just thought, want to remind you that everybody has this. I thought I would bring this to you all because it's true. This is from 2010, an article in the Washington Post.
Wow.
15 to 20 minutes. 15 to 20 minutes.
Okay, next person I'd like to have an introduction.
You can do the crystals. Hello everyone, my name is Diana Stoutmeyer, and I have lymphedema in my ankles and feet. And I had an aha moment while all this is going on. I just met with my endocrinologist, and she had stated that I had, because I give myself insulin shots in my stomach, she said I have a lot of scar tissue, and the insulin is not reaching me because of scar tissue.
Correct.
And I'm thinking like, oh, this is something that I need to address now. This is something I just found out about within the past couple of days. So, for something like that, remember, percussors also break scar tissue. So a lot of my clients who have excess scar tissue from like childbirth, they cellulite in the back of your legs, you can particularly take a handful of salt while you're laying down, place that salt on the abdomen and let that salt sit there for about 15 minutes. Take it off and percuss your belly. And I don't mean take the percussor and run it back and forth. That's not going to do anything. Place that percussor, right? Place it, and you don't need to do it a long time. I mean like 5 minutes, and 5 minutes is a long time. You simply take that percussor, lift it and place it, let it beat down some of that scar tissue some, and then move it around. You're going to notice pretty quickly that your abdomen is going to look different. Certainly going to feel different. Okay. Yeah. Thank you. You're welcome.
We have another introduction.
Another guest. Another guest. You do. Wow, it's really, you have a lot of clients. It's just a
Well, some of these folks don't come to us, and they come to the support group because, we try to educate as many folks as we can.
Yes.
And I wish they would all come here, but we understand insurance issues, not allowing us to take everyone.
I'm just amazed, Barbara. Where's your friend?
No crutches. No crutches.
How do you feel? I've noticed a little bit of something, but it's not as bad as it was. That's all.
And that wasn't even a full treatment.
No, it wasn't a full treatment.
No.
Wow.
It wasn't a full treatment. Yeah.
All right, we have another one up in the front who's talking.
ARNICA.
By the way, she just asked a question about arnica. For your breast patients who end up with hematomas post-op, arnica oral pills and arnica topical. That's what it does. It breaks up the hemocenter.
We will do this in the office if people bring a number of people.
Oh, I definitely. Seriously.
Well, we do that on the weekend. Just tell us, because we have a little conference center in our office.
What's the
For that?
So, you know, like the skin changes that they have.
Because eventually they'll be paying for the services, so the educational part we will charge.
They can
No,
do it while
I'm
they're
serious.
getting it.
So that,
And they can use arnica.
did you get our phone number?
Dwayne, did you get
The 301-552-1111. That's it. You know your husband got it.
What's the name?
It's called, well, Dr. Mussenden's office, but it's also Your Body by Design. So when you call, tell the staff, because we've got, you know, 2 people at the front, tell the staff you want to leave your information for Camille so you can have an event at the office.
Yes, absolutely. Yep.
I would love to go.
Your granddaughter, I watched her. She was just white, vigilant. How old are you? 10. Did you enjoy the meeting today? You seem like you were really interested. I watched her.
She took good care of her grandma. She watched her grandma go through some things.
I believe it. I believe it.
And we have one final introduction up here. Go for it.
Ellen, I'm mother to Karen over there.
Oh.
So I'm her support and caregiver.
That's great.
I I can, you know, and I actually found you by accident, the Lymphedema support group. And, so this is our second visit.
That's great. That's great.
Well, we enjoy being here, you all.
Would this help with weight loss? That's what I want to know.
Yeah.
Okay. Weight loss too?
Yeah. Yeah.
How does it do?
Everybody's ears perked up.
There's fluid and fat. There's fluid and fat, so everything running through the body is just heavy. It's heavy. And then if you've got too much that's settling in the tissues, now you're bigger. So yeah, when we do limbs, then we do a body contouring for weight loss. And it helps contour the body, it helps with energy level, it helps a lot.
But if you're gonna do that, you really need to be vigilant about wanting to detox and watch your diet. Because it'll only enhance it. It makes it easier when you do detoxes and people want to lose weight.
And some of our patients have noticed it's a noticeable weight loss in you know, in a few treatments.
Oh my
They're getting
God.
rid of
Right,
water.
yes, right.
It's
I
11
had-
pounds.
I bet.
13.
I believe it.
In 5 days.
I believe it.
Do you all have rebounders in your clinic?
We do.
Oh, good. Okay, I was about to say.
You can repeat offenders.
We do have that.
I was about to say. Okay, I would hope so.
Yeah, we got a lot of those.
Okay, good.
Are you guys using rebounders as well?
I use one at home.
Oh, you do?
Yeah.
What's that? What's the rebounder?
That's
like a
little trampoline.
I have one in the box at home.
It's really good. I do a lot of good
Rebound.
But I can't right now. I couldn't
Yeah.
do it.
Rebounders stimulate the limbs. Even if you stand on one, your body's eventually going to
What
start
about
to
a
do
Bosu
this.
bowl? Bosu? With no?
That's
Okay.
more for
Like a little
Okay.
tiny.
Yeah, those are the ones with the half up.
Yeah, the little personal ones.
Oh, yeah, I've seen
Sorry, in Walmart.
Because the trampolines, they kind of,
Yeah.
it all goes to what they were talking about, the waves, the vibration, the pulsation, so you're doing the whole body. So it just kind of
My daughter's running around.
yeah, but we love you guys.
My clients are till 6.
Thank you guys all for coming. I hope you guys learned a lot.
I do.
We do have some food left over if anybody wants some.
Oh, yes.
Oh, they already did. Okay, I need some salt, man. We need information in the brain. We need to do that little sign on the head.
mean, how do we access it? Do we just follow the body by design, or?
That would be the question for them. But I'm sure there'll be a way to access.
Lord have mercy.
Yeah, that was
Her little issues she keeps having.
You know what they never say? That's what we need to add.
It depends on like what you're getting treated and all that sort of stuff.
Because I want you to text me.
Yes.
Yes. Yes, my dear. We'll give you a card. I'm going to give both of you a card. And if you go on the website, you can go in. See the prices. So it matters but they're all between $100, $205, $250, depending on whether it's subscribed. Absolutely. I belong to I switch from there. Are you sleeping in that hyperbaric? Yes. Good. Fantastic. Yes. Yes. Very good. You're welcome, sweetie. The first time I freaked out. But yeah, some people do. But you have to come get us okay. Okay. You're welcome.
Girl, I'm trying to stay alive.
You're doing a good job. You got a good job.
I do.
Yes.
Thank you so much.
It's good to see you, hon.
Yes.
Next one is July.
Okay, I'll be there.
We're gonna be having a
Good Lord, yes.
When I get back to the office, I'm going to try to do what I do on Sunday. I thought I Did you go to Instagram? Just go to Instagram.
Oh yeah, I wanted to know if you were gonna post the video. That's what I wanted to know.
Yes.
Yes.
I am.
Okay, good.
Yes, I am. Yes, I am. Yes, I am.
Yes.